The topic of Medicaid is certainly being brought up more and more, which is why we're here with the Michigan Health and Hospital Association to kind of break down potential changes we could be seeing and the impacts and what we can expect. So joining me right now is Laura. Thank you so much for letting us stop by and breaking all of this down.
Thank you for being here and joining me, and we are thrilled to be part of this conversation because this is a very important situation right now facing Medicaid.
Yeah, absolutely. So let's start right there. What are we seeing with Medicaid and obviously the impacts that it could have on obviously our hospitals and healthcare?
Yeah, so the new administration in Washington and the new Congress are looking for substantial cuts to the Medicaid program. And you might have heard the number $880 billion over 10 years. Cutting funding is cutting care. There's no two ways about that. And we are working very hard to help people understand you can't cut funding much at all, and certainly not that dramatically, and maintain the healthcare services and the serving people who need those services in our state.
Obviously, these are going to have impacts on obviously the hospitals and healthcare, but what about those in like the rural communities?
We have 65 rural hospitals in Michigan based on the type of location that they're in. Some of those hospitals are larger, but many of them are very small and have as few as 15 beds, or even just, the UP, they might have a few less than that. And rural health is already extremely difficult to make work nationally. Over 290 hospitals have closed their labor and delivery services across the country in rural areas between 2011 and 2023 because it's so expensive to offer that service, and the cost of physician recruitment is so high, and the population is relatively small. So trying to figure out how to get enough funding to keep that service open is very difficult. It could get even worse. If the funding cuts came in at the initial level proposed of that $880 billion, I think there would be many, many hospitals in the country, and probably, unfortunately, in Michigan, even more severely at risk of closing altogether.
So let's get into Michigan families. What kind of consequences could they be seeing when it comes to, children, seniors, maybe those that might have disabilities in their families? What are the impacts if Medicaid is cut or capped or reduced?
Medicaid in Michigan is responsible for paying for more than 50% of labor and delivery. So at least half of our babies born in Michigan, their moms use Medicaid for their health insurance, and substantial cuts to that is again really putting labor and delivery services at risk. We also know that it's the largest payer for nursing home services, and many families have a loved one, it might be a grandparent, someone that you care about deeply who needs long-term care, usually in a nursing home setting, and further cuts to nursing homes. I don't think anyone thinks that we should be cutting the rates that we're getting for our folks. Closing services closes them for everyone.
Are we going to see any implications when it comes to in the state for like economics with potential job losses or the state's healthcare infrastructure as a whole?
Yeah, I think there's no getting away from it if the minor cuts are going to put things like that at risk. If a hospital loses support, if a physician office loses its support, ambulance services, our federally qualified health centers, all of these things, they have substantial employment. And if programs and services have to be cut, it probably means layoffs too. Number of areas in our state, in many rural counties, the hospital is the largest employer. Not only is it important in terms of the services that they can provide, but it's really an anchor institution for the community. So I encourage everyone to share their concerns with their Michigan member of Congress. Michigan Citizens Care is very much at risk with the type of cuts that they're discussing, and contact your member of Congress and let them know you're opposed outright to Medicaid cuts. Let them know that. If you are have some questions or concerns, make sure you press those on them.
Well, thank you so much for once again letting us stop by and breaking all of this down.
All right, thanks again to you too.
Speaking of what's ahead, next